infusion pump can be either used for administering fluids, food, liquid fluids, liquid diet, or even for medications. So, a trained user or programmer will set the rate and the duration of the flow of the medication to the patient. And we have an inbuilt software which helps in setting the correct rate and duration of the flow of the fluid to the patient. And it is generally given intravenously. Apart from IV, we can also send it through subcutaneous in the arterial area, in the epidural area, and it can be infused to other like in the antecubital fossa, etc. Okay. So the fluid. What is the use of infusion pump? Is we can administer fluid, we can send blood through the infusion pump, we can administer saline, electrolytes, medications like insulin, we can send anti-cancer drugs, etc. Okay. So why do we require an infusion pump? Infusion pumps are used for patients who are in the ICU. So it's a stationary based infusion pumps are used. Apart from stationary based, nowadays wearable, portable devices are there, and even syringe pumps are used. We'll see about it later. And there are a lot of other types like large volume infusion pump, patient control infusion pump, elastomeric pump, syringe pump, and enteral and infusion pumps are there. Insulin pumps are there. Now let us see. The first what is going to be learned is patient control analgesic pump. We can understand the term that the device is going to be controlled by the patient. So the fluid is going to be administered by the patient. The self-administration is done, and it is done when the patient requires the medication. So mostly this is used for analgesic medications, that is painkillers. So when the pain elevates, the pain is increasing, then the patient can self-administer the fluid using an analgesic pump. And second is insulin pump. This is going to be a wearable device. It is worn and it is connected with the abdominal area. And when the we have the glucose is monitored, and the glucose level when it is increases is propping up, then what happens is the insulin will be automatically administered into the body. Third is the enteral pump. Here we are going to send medications directly. So has difficulty in what happens is the vomiting will because of the vomiting they cannot take the intake the fluid is not proper. So in such a patient we can use for enteral pump. And next is the biomedical pump, which can be used for infusing both the higher doses and also the lower doses of the fluids. Next is the syringe pump, which will be seen in the latest class. And next is the elastomeric pump, where the walls of the different. So different types of infusion pumps here are patient control analgesic pump is the first one, where we can see that the patient is administering the medication when she requires it. Next is the infusion pump, where you can say that insulin pump, where we can see that the insulin pump is worn by the patient, and we can see that the infusion pump is from the infusion pump it can be administered to the abdomen, and we can see that there is a patient glucose monitor where it senses the glucose level of the blood, and then infusion of the insulin happens. And third is the enteral pump, where we can see that the patient's the fluid is passing directly to the patient's digestive tract. And next is the multi-channel pump, where we can see that multiple medications can be sent through a single device, and it is directly connected to the patient through a single tube. Next, last is the elastomeric pump, where as I said, it is a pump like a balloon-like device, and the pressure maintained by the valve is going to control the flow of the fluid. To work on the basis of peristaltic mechanism. Peristaltic mechanism is nothing but it is one which we have already learned in our smaller classes. Digestive tract works by a peristaltic movement. Similar way, here we can see that there are finger-like projections which is present outside the. It is based on its plate is present inside, and we are going to fit the tube here based on the movement of the finger-like projections, alternate compression and relaxation of the finger-like projection. The movement will be controlled. The rate has been set, and I am going to administer. It is a total volume is there, and we can see the type of medication that can be changed within settings. And now I have started administering, and we can say that there is flow of the fluid. So we can see that there is a flow of the fluid. There will be inadequate instructions provided in the manual to set the alarm. So if an alarm, if there was an issue, that issue may not be brought to the notice of the health problem